The day actually began with Prime Minister Narendra Modi getting vaccinated and sending out a strong message. Prime Minister Modi, in fact, walked in early this morning to AIIMS, where he got his first Covaxin shot. Yes, he has taken the indigenously researched, developed, manufactured Covaxin. And obviously, the message he's sending across to everybody who's hesitating is that you don't need to hesitate. He also congratulated doctors and scientists for the efforts and appealed to everybody to take a vow to come and take the vaccine and make India COVID-free. So the demand that everybody had, the question that everybody had about when PM will take the vaccine, why doesn't he lead from the way? Well, on day one of when it was open to people beyond the healthcare workers, when it was open to the category that he comes from, those above the age of 60, Prime Minister Modi was the first one to get the jab. But tonight we're actually going to focus on you. Tonight we're actually going to tell you the details that we know about the process, the clarifications that we sought and got from the government on the process, on the issues that you face, and we highlighted through the day. Tonight we're going to talk about your experience, and if you have any other queries over the next 1.5 hour, viewers, we are going to simply focus on the vaccination drive, because I believe for India to move on from here, whether it's revival in economy, whether it's revival in the businesses, whether it's schools and colleges having to restart, whether it is about us going back to our normal life, whether it is travel sector to boom again, all of that really depends on how we take forward our vaccination exercise. So it is extremely important that we give it the due focus, the due importance, that we raise the issues that were witnessed on day one, that we learn the lessons from day one, highlight it to the authorities so that they can be fixed. For example, let me give you what happened today morning as an example and a story. There was much confusion because people were trying to register on the COVID app, an app that's available on Play Stores and every other portal to download. People were downloading that app, not just today, but for the last few days, trying to register and get themselves a vaccination slot. And when that didn't happen, when they were being asked for a password that they had no idea about, it just led to a lot of confusion. When we began to highlight that and seek a clarification from the government, we were told that the app has nothing to do with the process for you. That the app may be for the officials, the beneficiaries have to register on the COVID website, which is different. The website, the portal is different from what is there on the app, which is not meant for our access. And if you don't want to go to the website, you can use your Arogya Setu app. That's the app you can use. There's a whole new category and segment that has been developed in your Arogya Setu app that allows you to punch in your details and get your vaccination slot. So this is a big clarification that came in, that if you're trying to register on COVID app, don't. That's not really for you. Now, before we start taking your phone calls, and our phone lines are open, I want to go across to our reporters and highlight some of what we saw today. Now, keep in mind, many people did have a very smooth experience on pre-registration, on walk-ins. They got their jabs, they were guided well. There were others who didn't. So in no way does it reflect a larger nationwide trend. But these issues that we highlight today are important for authorities and governments to note, because only then will they be fixed and ensure that we have a speedy, smooth vaccination drive. Joining me this evening from across the cities, Mugilan joins us from Chennai. From Bangalore, we have Shrija joining us. From Mumbai, there is Disha. First up, let's go across to Ayushman joining us from Delhi. Not only tracking the vaccination drive in Delhi, but also tracking how the center is looking at it, following up and issuing clarifications. Ayushman, let's just talk about the first couple of hours. A lot of those problems seem to have been fixed by the second half of the day. But what happened in the morning?
Well, Tanvi, there was perhaps some confusion that the Health Ministry clarified that the COVID app that is available on the Android is not actually for people to be registered, but it is for the administrators. But nevertheless, once this clarification came, the portal was used. We are currently being told that over 2 million people have registered, and if you go by the expectation that 2 people almost would have registered by their account, it goes almost to around 40 lakh people registering on the very first day. Now, there were some glitches, but of course, the COVID chief has said there were no glitches. It was smooth. It has been acknowledged that there were some hiccups. It will be improved in the coming days. But overall, if you see the portal and Arogya Setu was used for vaccination registration. And this is not just one vaccination, it is on-site is also allowed. The healthcare and the frontline workers are also registered for the first and second dose. So overall experience was, there were hiccups, there is a room for improvement, but the places where we saw some hiccups, but overall if you see the app needs some improvement. But currently if you see the health ministry's perspective, they feel that given the load that it was suffering, it was satisfactory.
Okay, so they're saying that given the load that it faced on day one with many people logging in, the response was satisfactory. There was no major glitch as such. Well, let's find out also from the other reporters joining us from various cities. Disha has been from 8 a.m. reporting for us from various places. Disha, take us through the details. What did people here tell you?
Well, Tanvi, like you rightly said, that the first couple of hours, the first half of the day was really chaotic. Specifically here in the Mumbai centres and across the centres in Maharashtra. In Mumbai, there are about 8 centres which were permitted today to vaccinate senior citizens. And across Maharashtra, if you talk about more than 500, including government and private. So first off, initially, when we spoke to the senior citizens, they did not really face any issue registering on the COVID portal as such, because most of them were not really registering themselves on the COVID app. So that sort of confusion did not really come in front of them. But yes, what really was chaotic, that the hospital staff and these centers were unable to function the COVID portal till 12:30 or 1 p.m. today. So at least for the first half of the day, they were not able to log in at all, and there was just crowd after crowd of senior citizens because they had already registered themselves on the COVID portal. They had got the generic time slot between 9 a.m. to 5 p.m. You can really come in and get the jab. So depending on that, of course, the message which was communicated, they did really come, but then it was a lot of chaos because they did not know the update as to when the portal will start working, when the servers will begin working, and only after that few of them did really get tokens. Few of them was told that the tokens are out of just full to its capacity. So all of these were little chaotic situation. The senior citizens who were waiting for 4 to 5 hours, few of them were diabetic patients. They spoke to us clearly saying that they have no update at all. So all of these were minor and major issues as well across centers that were reported. Majority, of course, we saw them pre-registering on the COVID portal for that matter, and 40% of them we saw, walk in as well. But at the end of the day, after the second half, Tanvi, about from 1:30 onwards, we did really see a smooth functioning across the centers in Mumbai and Maharashtra. And at the end of the day, from few centers that we reported, we actually got an update that more than 450 people or 600 senior citizens are vaccinated on the first day itself. So we are yet to receive final numbers from the state on the first day of vaccination. But overall, of course, first half, it was chaotic with technical glitches, but second half did really cover up the whole day.
All right, Disha, thanks so much for getting us those updates. In fact, one of the things that Disha highlighted, and I want to take it across to Shrija as well. Shrija, what was the kind of ratio that you saw of those who had pre-registered versus the walk-ins? Because that's a new option that has been given, keeping in mind that many of the elderly may not be tech savvy.
Well, that's right, Tanvi. In fact, it's a good question because that was one of the questions which was asked by the senior citizens themselves. Of course, we did go to a lot of senior citizens. The first question that they asked us was saying, we don't have smartphones, nor do they have internet as well. So how am I supposed to register either on COVID app until the clarification came from the health ministry? Apart from that, until the later the clarification said that you have to do self-registration or on the COVID portal. And of course, a lot of, in fact, more than Mumbai, we looked at a lot of people, especially the senior citizens between the age bracket of 45 and 59 with the comorbidities, and above 60, we saw quite a lot of senior citizens across all the 270 centers in the state of Karnataka, especially walk-in. This was just on Saturday and on Sunday. We understand the health officials, especially in Karnataka, did categorically mention saying that at least in urban areas, we will allow the senior citizens, especially to register on the COVID app. This was something which was told by the health officials. We will allow them to register on the COVID app, but as far as the rural areas are concerned, we will allow them to walk in. But that was not really the scene as far as today being the first day is concerned. We did see a lot of people just walk in and try to register. But there again, we did witness quite a lot of confusions, and there were also arguments right there, because if you're really going by the COVID portal, it does talk about if there is a self-registration, it does talk about the timing is between 9 a.m. and 6 p.m. So a lot of people had arrived there at 9 a.m. at various centers, but then they were informed by the doctors and the nurses as well, sorry, we cannot go ahead with the vaccination now because we are facing survey issues. The COVID portal is also not loading, and those were certain issues that we did of course witness till at least about from 9 a.m. till about 1:30. This was across all the 270 centers here in the state of Karnataka. Now that is one issue that we witnessed. The second issue is to be highlighted here is most of these 270 centers, at least some of them had still not received vials. Some of the hospitals received the vials only post 3 p.m. So that was also another issue where we witnessed here on ground.
Okay, that's very interesting. Well, of course, even for the states, today was day one. They will also have to get a little bit more organized and improve as they go from here on. Remember that much as it is the center's responsibility, they make the plan. The states will have to also implement quite a bit of it. Mugilan, coming to you next. Let's talk about the response and the turnout in Tamil Nadu, specifically in the city of Chennai. You know, how was the process?
Unlike the first phase, in the second phase today, we saw an increased enthusiasm among the beneficiaries the whole day, at least in the important centers here in Chennai. The whole day, the vaccination centers were completely busy. Since 9 a.m., we have seen several beneficiaries, the two elderly people coming forward to take up the vaccine right from 9 p.m. And we were at Rajiv Gandhi Hospital from 9 to 10. At least 100 beneficiaries have already taken up the vaccine in the morning today. So that is a kind of enthusiasm that was prevalent among the elderly people for taking up the vaccine today. Yes, there was glitches in the COVID portal, but here the alternative arrangements were made by the Tamil Nadu Health Department. Even if a beneficiary wants to come and wants to make a walk-in vaccination, yes, they were allowed, and their details were collected, their Aadhaar card were collected, and then they were administered the vaccination. But the details were later uploaded in the COVID portal. So Tamil Nadu state government have already made several alternative arrangements for the people who does not have access to the internet or any access to registering in the COVID app. Yes, when we spoke with several of the elderly people or the beneficiaries who came up for the second phase, they said that the entire process was smooth and they could get the vaccination done in at least 30 minutes to 45 minutes. They got their vaccination done and they returned, they left the hospital also. So that is the kind of situation which prevailed in most of the important centers here in state of Tamil Nadu. And yes, we are still waiting for the numbers from the rural area. In another 1 hour, we will be getting the official numbers. But on the day one of the second phase of the vaccination, there's been increased enthusiasm among the beneficiaries to take up the vaccine. As far as the numbers, Tamil Nadu numbers, what we're getting from the health department is that in Tamil Nadu, there are 1.6 crore beneficiaries who are aged above 60, and their details has been already been collected by the health department, and the registration works also has begun. So in the upcoming days, we will get to know how enthusiastically the beneficiaries coming forward to take up the vaccine.
All right. Here's a big thank you to Mugilan, Shrija, Disha and Ayushman for through the day bringing us the details, what's happening on ground and summarizing it for our viewers here on Urban Debate. Thanks so much, guys. Well, let's move on and say good evening to the experts who are joining us. And now it's your turn. Pick up the phone, call us and ask your query, and we'll try and give you as many answers as possible. Dr. Anish T.S., Associate Professor for Community Medicine at the Government Medical College in Thiruvananthapuram, joining us this evening. He is also a member of the expert panel for COVID-19 for Government of Kerala. Dr. Anoop Amarnath, Chairman of the Geriatric Medicine at Manipal Hospitals, joins us this evening as well. He is also part of the Critical Care Support Unit for Karnataka Government. Dr. Swaminathan joins us this evening, Director for Infectious Diseases at Gleneagles Global, and Dr. Sunila Garg, Professor of Excellence Community Medicine at Maulana Azad Medical College, New Delhi, also a member of the Lancet Commission and the COVID India Task Force. Dr. Garg, let me begin with you first. You've been part of the conversations, discussions that were taking place before this vaccination drive started. To your mind, what were the lessons from day one?
You see, basically, we were looking at that the people should be able to register themselves, and they should be register through the platform. Then number 2 was through Arogya Setu app, and number 3 they could be also walk-ins, because India is so diverse. We cannot have everybody who is tech savvy, who is app savvy, and all that. So from the beginning, these 3 provisions were allowed, and we were focusing on 2 groups like 60 plus and people who were 45 plus and till 59 who were suffering from comorbidities. So that was from the beginning. But the major challenge was exactly, how develop the app and all that. And this app which has been developed is really a wonderful app. But primarily any app or any digital platform will have some initial glitches, because if you will imagine, this app has got the capacity to enroll 50 lakh individuals in a day. But we are so big and so diverse. So that is why, there is a little bit of communication gap, but I'm sure that over a period of time, this will get sorted out. And, because we are aiming now at 27 crore individuals in different parts of the country. And you yourself beautifully showed through your different people across the country that how many challenges are there, but at the same time there are so many opportunities. We should look at also how people got their good experiences of getting themselves, they could walk in, they could get themselves vaccinated. And also I'll tell you, till yesterday also it was being told that this COVID app will be started better functioning after 12 o'clock. This was already there. And also people who are, the booths are functioning with the old people. Older people means who have registered earlier. That means frontline workers, healthcare workers, immunization is already going on in these vaccination centers, except for the ones which have been opened under PMJY and those who are, also catering to CGHS beneficiaries, and who are also catering to, basically any of the state health schemes. So these are new, but the other ones, which are the government platforms, they're already providing vaccinations free of cost. So for them also, this was a newer kind of at the booth, though the people were enough sensitized, but then it takes time. So, initially they catered to the people who were already registered. That means the ones who were coming for the second dose and the frontline workers and all that. And then secondly, they started looking at people who were from the older category, that is from 3 o'clock onwards. But you see, somewhere we have to be very clear that it is better if we register ourselves and go. But, there are areas like rural areas or, where people are of older category who cannot access the COVID platform themselves. Their healthcare workers also will be taking them from households, so that they can accompany them to the healthcare facility. So that will be important, or they will direct them to the healthcare facility. So these are some of the important things. But let me tell you that first day always in any such a big launch is full of barriers and challenges. So I'm sure that within a day or two we'll be definitely much more smoother. And also, it was pointed out that some places the vaccines did not reach and all. Yes. Because you see, from few thousands, we have gone to many thousands now, right? And district immunization officers are the focal points. So that's where, it takes time exactly to look at the whole thing. But, I'll say that it is a well-begun job, and see the number of registrations.
Correct.
19 people already registered. So I see this as a very big satisfying point, with Prime Minister did it from front, going early in the morning, getting himself vaccinated so that, people can come forward. And I'm sure that quite a number of elderlies would have seen him and walked to the point so that, they can get themselves vaccinated.
Well, yeah, definitely when the side of your Prime Minister and your central ministers and chief ministers taking the jab should invoke some kind of confidence in people as well. But Dr. Amarnath, if I can come to you on the issues that individually also several of the states face. A lot of this planning was done at a central level and told to states just a few days ago. But it will be the states who will have to, walk the last mile and implement it on ground.
Absolutely. I think, health being a state subject, it's up to the states to ensure that the implementation is done seamlessly. But I think one thing which we really have to understand is this is the world's largest vaccination drive. And, in India, it's huge numbers. So whatever issues are there, it would get streamlined in due course. And of course, the other thing which I said yesterday, I'll repeat it now, it's a watershed moment in Indian healthcare. Because the reason I say that is because if you look at the mortality, the number of deaths which happened, that was the highest in the elderly population. And this is exactly the category which is coming into vaccination from today. Of course, there would be certain glitches, but I think overall, given the fact that they have been prioritized, and on the ground, in fact, at our hospital, we saw a 90-year-old getting the jab first. So I think it goes on to show that, it's well begun. And then if we do manage to make sure that this particular vulnerable category is immunized, I think that will go a long way in ensuring mortality is reduced. And also the fact that, technology, a lot of elderly people may be technology averse. So the option of walk-ins was also given. And what we saw on the ground was a lot of elderly people opting for that. So I think, in between technology-led and non-technology-led, I think a lot of elderly people will be coming forward, especially what happened in the morning with our leader leading by example. I think it's a great start. We have to sustain the momentum. Whatever glitches are there, I'm sure that will get ironed out. But the fact that the most vulnerable population is now getting vaccinated, I think is a big step forward in our fight against COVID.
Oh, yes, absolutely. And in fact, I just want to point it out to our viewers in case they haven't heard it. But, one of the nurses who was part of the team that administered the vaccine to Prime Minister Modi later on told the media that, well, when she gave him the jab, he actually said, "Arey, itni jaldi ho gaya, pata bhi nahi chala." Essentially, the Prime Minister also trying to get across the message that people don't need to be scared about the jab. You won't even realize it. It's that plain and simple, and everybody should come out and get it. So that was the message that we clearly got from that interaction. But here is one thing I did want to ask. Dr. Anish, how is the allocation of vaccine doses going to work between the states now? Because it's open, at least from the demand side, people registering, in various states could vary. Now, does the allocation of doses also vary accordingly?
Definitely. Actually, we have to think many aspects. One is the population size of different states of India. That is one thing. Second one is the proportion of elderly and people with comorbidities will be different in different states. If the state has got high life expectancy, long life expectancy, definitely the proportion of elderly will be much more. For example, in Kerala, the proportion of elderly that is more than 60 years is more than 15%. But in India, it is only half. So that is a difference. And another thing there is how much vaccination is needed or how much of the people should be vaccinated to achieve herd immunity through vaccination. That is another thing that we have to address. That means if the state has got high incidence of cases, that means you have to give more vaccination to those states so that the outbreak will be stopped by these kinds of vaccination. So these kinds of epidemiological and social aspects should be there. And it is actually very promising that the people are showing much enthusiasm on vaccination. And it is good that Prime Minister Modi has actually set that kind of an example. He has taken the India's vaccine, which has got maybe a larger criticism. And all those things are actually very good. It's actually a very good move, other than the initial criticism and all. But I think it is whenever we are distributing vaccination, these kinds of epidemiological, social, and demographic things should be considered.
Oh, yes, absolutely. And our callers are waiting and standing by with their questions. But very quickly, let me start off with one, because I had a lot of people tweet to us about this, earlier in the day, also send us messages about it. And maybe Dr. Swaminathan, you can help us understand this part. Many are saying that when they tried to register, there weren't any dates available for the next 5 days till 7th or 8th. Why is that happening? Is it because we've opened a limited window, or there is some problem in the access right now?
I think it's a good thing to start small and upscale it, because when we start, that's when we'll realize where the glitches are. Because it's a new thing that we're doing. We've never done adult vaccination in any size. Let's forget small size. We've never done adult vaccine. So it's a new territory. So let's do it right, because we don't want to burn ourselves or create a negative impression in the community. So it's worthwhile going slow and accelerating as we go along. And also making sure that people don't make the mistakes again and again and reinvent the wheel at every center. So it's important to make sure that we upscale mistakes and gaps in our SOP, so that all other centers are aware of that, and make sure that there's a patch available so that that is fixed for all centers all at one go. So I think those kind of messages need to go out. So most important thing is that this is a journey, and the second dose, we don't know when it's going to come out. It may get pushed back because of the new data that's coming out. So I think people need to understand that a couple of days this way, that way, even a couple of weeks is not going to make a humongous difference. So I think patience is a virtue. Let's all get our vaccine. And obviously, it's so nice to see so many people calling and asking, can I take the vaccine? When can I get the vaccine? It's really warming to see that. But at the same time, I think it's important for us to remain patient about it and know that we will get our chance, we will get our turn, and that you don't want to run into a clinic which is already overcrowded. And remember that the concepts of preventing COVID are still valid today, because you don't want to go into a clinic which is overcrowded, where people are not wearing a mask, where there's too much jostling and too many people around. You want a reasonably quiet, well-handled vaccine center, so that the vaccine center does not become an amplification hub. So we need to keep all of those things in mind. Okay. So let's do it the right way.
Okay, no need to rush. Let's do it the right way. And obviously everybody will get their turn as we go about and as we find the loopholes in the system. Dr. Garg, are you saying something? Yes.
Yeah, Tanvi, there is one more thing that already, when you start registering, there are already people who are registered for a particular day. That means there are already frontline workers. And if suppose you have got a margin of 200 people and 50 or 55 are already registered, then we will have only provision for, let's say, 100 odd more. So maybe 100 people have registered, because those people are the ones we are in a stage where we are looking already at the second dose of healthcare workers, and also at the frontline workers who are already, have been given a slot. So we have to adjust amongst that also. So as Dr. Subramanian is pointing out, that we must be patient. Our turn will automatically come in. That's what is the beautiful point which he made. Thank you.
Yes, absolutely. So we can try in a few more days. Keep in mind that we also have to give second doses to a large percentage of the first lot that got vaccinated in the first 1.5 months. Let me go across to Salim Ali. He's calling us from Bengaluru. Good evening. What's your query?
गुड इवनिंग मैं हिंदी में बोल सकता हूँ?
जी जरूर।
पहले तो हमारे वजीर आजम का बहुत बहुत शुक्रिया। उन्होंने ऐसी लीडरशिप दिखाई है जो, मैं तो बुढ़ा हूँ, मैंने ऐसी लीडरशिप तो फील्ड मार्शल मानिक शॉ पे देखी है, जो लोग उनके एक बोलने पे हर कोई खड़ा हो जाता है। आज सवेरे आप विश्वास नहीं करोगे कि उनके जैब के बारे में खबर आते ही हमारे मोहल्ले में हर कोई जिसके पास इंटरनेट है उनके घर में जाके उनको रिक्वेस्ट कर रहे थे, लड्डू के साथ प्लीज हमारा भी रजिस्ट्री कर दीजिए। इतना जोश, इतना अच्छा, बहुत बढ़िया चीज है ये। और दूसरी चीज ये है कि मेरा ये कहना है कि अगर आज जो वजीर आजम ने किया है उसको इंग्लिश में अगर छोटा सा मैं बताऊं कि इट हैज रियली मेड ए न्यूज, N फॉर द नॉर्दर्न हॉस्पिटल, W for the Western man, and East for the clothes, W for the Western man, and South for the nurses. बहुत thanks.
Okay, thank you for that, Mr. Salim. Did you have a question you wanted to ask your experts? Okay, we seem to have lost that line, but clearly great words, and I think that's the point we were making about the message that Prime Minister Modi has sent and how that is going to encourage more people to step out and get themselves vaccinated. So that's one of our viewers who's called in with that view. I also had many viewers calling us earlier in the day and asking us about the various comorbidities. And for example, Dr. Swaminathan, if somebody has diabetes, now how do they go about it? Is there a categorization, controlled, uncontrolled? Will they need a certificate from their doctor? What should they do?
See, the good news is, as long as you're not currently sick with an illness like a fever, anybody can take a vaccine. The question is how effective it will be. So obviously you want to be in the best state of health that you are so that you can get the vaccine to work as well as possible for you. So if you're a diabetic, it's good to have your sugars under control and so on. But no, do not worry about those things. If you are 45 to 60, yes, you need to carry a letter from your primary care provider explaining what comorbidity you have, which entitles you to the vaccine. If you are 60 and above, you don't need anything. All you need is proof and, of course, registration, and come and take the vaccine. So do not worry about that. The vaccine works very well. The efficacy may be slightly constrained in some people, like transplant recipients and things like that. It's not the safety that's being debated. The safety is good. The efficacy may be a little lower. But that's a problem that's going to happen with every vaccine, irrespective of what you use. So that's not a reason for us to worry about taking the vaccine. There are very few conditions which are really contraindications or absolute things where you do not take the vaccine, like an allergy to a previous vaccine use and things like that. So do not worry about it. People who have medical problems are the ones who should preferentially get vaccinated because they are the ones who are more vulnerable than everybody else. So please go ahead, get your vaccine straight away.
Well, thank you for that. I hope that helps because a lot of our viewers called up with specific questions about, the diabetes ailment. Ahmed is on the phone line. He's calling us from Mumbai. Good evening, Ahmed. Go ahead, please.
गुड इवनिंग मैडम. मैडम, मैं हिंदी में बात कर सकता हूँ?
जी जरूर.
जी, अस्सलाम वालेकुम. मैडम, मैं आज पता कर चुका हूँ ये जो कूपर अस्पताल है जो बम्बई में जो जुहू में है, मेरे चचेरे के भाई, वो उनको ट्रीटमेंट करवानी थी. ये जो पता करना था कि एक तो है कोविड है कि नहीं. तो मैं वहाँ गया था रजिस्ट्रेशन सब करने के बाद, और वहाँ पर उन्होंने कहा कि ये जो ब्लड जो है, जो खून, वो निकालेंगे नहीं. तो हम अभी यही पूछना चाहते हैं कि अगर खून नहीं लेंगे अस्पताल में तो हमें मालूम कैसे होगा मैडम?
नहीं, आप कोविड टेस्ट की बात कर रहे हैं या वैक्सीनेशन की बात कर रहे हैं?
जी, ये जो वैक्सीनेशन जो दे रहे हैं, ये जो अगर कोविड है या नहीं है उसके सिलसिले में है ना.
ओके.
तो हमें यही पता करना है कि अभी क्या देंगे. अभी पता तो करनी है ना डॉक्टर को. उन्होंने पता ना होगा ना मैडम कि इनको कोविड है तो ही वो कुछ दवाई देंगे. अगर नहीं है तो शायद कुछ और देंगे. तो हमें वही पता करना कि ये करते कैसे. ये आप थोड़ा इसके बारे में जानकारी दे पाएंगे?
ओके. डॉक्टर सुनीला गर्ग, जी अहमद जी, शुक्रिया हमसे ये सवाल पूछने के लिए. डॉक्टर सुनीला गर्ग.
पहले तो धन्यवाद ये सवाल पूछने के लिए. ये बहुत ही अहम सवाल है जो काफी लोगों के जहन में आता है कि हम अस्पताल में जाएंगे तो पहले हमारी बीमारी की जांच होगी, फिर हमें वैक्सीन दिया जाएगा. सबसे पहले तो ये है कि जब आप अस्पताल में जाएंगे तो आप हेल्दी होंगे. इसका मतलब है कि आपको कोई लक्षण नहीं होंगे, यानी कि बुखार, आपको सर्दी, खांसी, सोर थ्रोट या बहुत ज्यादा आपको शरीर में वो दर्द हो रहा है, तो ये सब लक्षण है. तब आप कोविड की जांच अलग से. उसका वैक्सीन से कोई लेना देना नहीं. वैक्सीन से लेना देना तब है जब आप बिल्कुल हेल्दी हैं और आप वहां पे वैक्सीन साइट पे वॉक इन करेंगे तो आपको वैक्सीन दिया जाएगा. इसके अलावा अभी थोड़ी देर पहले ही हमने बात की कोमॉर्बिडिटीज की, यानी कि 45 साल से ऊपर और जो 59 साल तक के लोग हैं उनको कई डिजीजेस, जो कि 20 डिजीजेस हैं जो कि या बीमारियां हैं जिसको कि ऑलरेडी कोविन प्लेटफॉर्म पे भी बताया गया है कि जैसे कि मैं कहूँ डायबिटीज, हाइपरटेंशन या कोई हार्ट के वॉल्व का कोई डिजीज है. इस तरह की 20 तरीके की बीमारियां हैं जिसके लिए डॉक्टर से सर्टिफिकेट लेके जाना है. तो उसमें आपको जो है वो इंजेक्शन कोवैक्सीन या कोविशील्ड मिल सकता है. परंतु अगर आप बीमार हैं, यानी कि आप सोच रहे हैं कि आपको कोविड के लक्षण हैं, तो उसकी जांच अलग से होगी जिसको कि हम RT-PCR टेस्ट कहते हैं. तो अगर आप उसके लक्षण हैं तो आपको वैक्सीन नहीं दिया जाएगा.
थैंक यू सो मच डॉक्टर सुनीला गर्ग एंड आई होप कि जो अहमद के क्वेरी थी वो इससे रिजॉल्व हो पाई. जस्ट टू मेक इट क्लियर कि वैक्सीनेशन शॉट के लिए आपको कोविड टेस्ट रिपोर्ट की ज़रूरत नहीं है. अगर आपके कोई सिम्टम्स नहीं है यू कैन गो एंड गेट द शॉट. वेरी क्विकली बिफोर आई गो बैक टू आवर पैनलिस्ट विद माय ओन क्वेरीज, मिस्टर विजय कुमार इज ऑन द फोन लाइन एंड ही इज कॉलिंग फ्रॉम गाजियाबाद.
Yeah, Tanvi, can you hear me?
Yes, I can hear you. Go ahead,
Yeah,
please.
good evening to everybody. I just rang up to make a small suggestion because earlier in the evening I heard you speaking to the expert who had created this COVID app and all, and he says there are no glitches or all have been removed. Well, I have been trying since morning till evening, but I have just reached the stage where I have registered, but I am not able to select the center. And interestingly, when I selected Ghaziabad, I selected the block. The list of centers which are coming are very interesting. It is something like some place ki Juggi, some Hanuman Mandir, or some ki Dukan. Now, this can be verified actually when you have a drop down from Ghaziabad. My suggestion is that if these people create an email ID where we can share the screenshot, then specific problems can be addressed. Otherwise, none of us, will be able to reach the numbers or tell what the problems are coming.
Fair enough. Thank you for that, Mr. Vijay Kumar, calling for that suggestion. Might I also say that, for our viewers and everybody else, that if you don't want to get onto the app or if you're having the trouble with the website, not the app, you can always go to the Health Ministry website and download the list of vaccination centers, and the governments will keep on adding to this list. So this list will also keep getting updated as we go along. And once you know which vaccination center is around your area, basis where you live, then you can go there and, as a walk-in and get yourself registered. Now, one question that I wanted to ask our panelists, and maybe I can start off with Dr. Anish. Dr. Anish, are states going to be anticipating a larger chunk of walk-ins? I mean, today was day one, so maybe too soon to say basis the trend today. But considering that we are looking at a population which is largely beyond the age of 60.
Definitely, we are anticipating a large number of walk-ins. In Kerala, that we have got Akshaya centers. Akshaya centers means dedicated computer facilities available in nook and corners of the state. So we are trying to link it up so that the person can walk into Akshaya Center and get it enrolled and they can come over and get the vaccination. Those kinds of things should be maybe there. So it is very difficult for our vaccination center to take up all these things because the people are actually very busy with vaccination. Today, I am also in charge of a vaccination center. And what happened in our locality was we were achieved almost 150 vaccination today, but another 100 or so, we were giving tokens and send them home to come tomorrow. So these things is going to happen every day. So that will be very difficult for us to handle the registration as well as vaccination in a vaccination center which is set up in a PH. So if you can just link to some kind of a computer center nearby, then that will be a very good model that we are actually trying to practice in Kerala.
So essentially, and that's a very interesting, idea that the Kerala government is using, and I'm assuming that most of the states will look at using some of their existing machinery of government programs and using those groups to help people register and get onto the organized system. Dr. Anoop, would that be something that each of the states will have to look at, especially in smaller towns and rural areas?
Absolutely. I think one of the biggest advantages that we have in India is if you look at the vaccination program, whether it's pulse polio or the other vaccination program, there is a fairly robust vaccination infrastructure that we have in place. Combine that with the primary healthcare centers and combine that with the private healthcare centers, which have now been roped in. So I think overall there is a fairly good overall infrastructure that we have, which we can use in order to ensure that this entire vaccination is a success. So there are infrastructures in place. People who have been part of the vaccination program, they're well versed with how the vaccination works. But I think we'll just have to leverage this, both the government setup and the private setup, to ensure that we have a good success in this entire vaccination program.
Oh, yes, absolutely. In fact, let me take that conversation forward, because I think this is where Dr. Swaminathan, a lot of role of the states will come into play. There is one organized setup where we ourselves can go and register, or we help our parents and relatives, to register, and that part is known. The unknown part is the walk-ins. And then the third level is people who are unaware must be reached out to so that they too have the same opportunity.
Beyond that as well, please understand that these are older people, and for them to make numerous visits is going to be very, very difficult and very taxing for them. May not have lots of mobility options, they may not have transportation options. There are quite a few issues here. So I think we need to have a system by which we can actually plan for even 500 to 1,000 visits per day. And we need to have surge capacity in place so that we are able to capture practically everybody who walks in. And the ethos should be shoot everybody who you can, meaning with a vaccine, of course, and make sure that they get the benefit of the vaccine at that point. Adult vaccination in the US, they keep saying, when is the best time to give the adult vaccine? When you have the patient in front of you, because you don't know if you'll have another opportunity to get the patient again and give the vaccine. I think that ethos has to be adopted, and we need to find ways of developing surge capacity right now so that we cater to the surge. And I see a surge happening in the next 7 to 10 days. The first 7 to 10 days is going to be very heavy, because the people who are really interested are literally going to come running to the vaccination center saying, I want the shot. And like has been pointed out, not everybody has the ability to go on an app or go on a platform and find out how to do it. Let's just keep it open. Let's make it as easy as possible so that we can turn around these people as quickly as possible. And many of them are well connected. If it make it as seamless and as easy to handle as possible, by word of mouth, I think the coverage will start improving. There is one other issue I think we need to look at. We also need to look at the vaccine refusers, and I think that also needs to be looked at carefully. Let's also look at why people may be avoiding the vaccine, because a lot of it may be a misconception or wrong kind of information being passed around. I think that also needs to be surveyed, and specific measures need to be taken to ensure that that doesn't become a problem in this age group, in this group that we are looking at, because this is the most vulnerable and the return on investment is highest for this group.
Yeah, in fact, and because we've had a series of these conversations, often the experts who join me tell me that they get the most number of queries from this age group. And everybody who's above the age of 50 or 60 is saying, oh, but I have, a heart condition, or I have a kidney condition, or I have a sugar condition. Should I be getting it? Is it safe for me? And our experts, try and tell our viewers all the time that yes, in fact, you should be getting it more than anybody else, because you need it more than anybody else in the country. So that's one thing that I think we should keep on repeating constantly. Now, let me also tell our viewers what is the process, and how do you go about it when you go onto the website. It's a very simple process, but if you're struggling, there may be certain issues in terms of the time that it takes, basis how many people are on that, how much traffic is on the website. The process may be slower. It may also depend on the kind of internet connection that you have. That could also slow down the process. But if we can just play it out for you and hopefully help you understand it better and make you a little bit more aware of what's there on the website. So first step, of course, is when you go to the website, click on the vaccination tab. That's step one, that you have to click on the vaccination tab. This is where you can see on the left side of the screen as well. Then you press register now. After that, the system will ask you for your mobile number. So you will have to punch in your mobile number, which is very important, because all the communication and the follow-ups will also be updated to you via your mobile number, including a one-time OTP that will be sent to you. Today, we heard a lot of people saying, well, the OTP never turned up. Again, these are few initial days issues. Hopefully, as we go along, these issues get ironed out. So the OTP will be step number 4. Then step number 5 will be filling in your photo ID details, which is where you will have to upload your identification document. There's a list of documents that you can refer to and upload. Step number 6 is you punch in your name, you select your gender, put in your date of birth. Age, of course, is an important criteria here, so which is why that will be asked. Step number 7 is scheduling a vaccination slot, which is where you can decide your date. Then the app, the Arogya Setu app, will tell you, find center near you. And it will give you a list of options. From that, you can find out which center is most convenient for you, which one you would like to choose. Choose that center. Government centers are free vaccination. Private centers, you have to pay 250 rupees. You select your date and your center. You check availability. It may look like right now, it may show you that it's not available. If it's booked already, you wait for a few days and you try again. Step 10, of course, is confirming the appointment. That's the basics. There have been hitches in these 10 steps that we've seen today, but hopefully in the coming few days, they will get ironed out. I'm going to thank our panelists and experts for joining us. We have a lot more, so keep the calls coming. I'm going to take a very short break. This is a special broadcast. We continue all the way till 9:30, so stay with me.